cryptocurrency to buy illicit drugs from the dark web and traffic them in Vancouver.
BC United calling for an investigation into how the BC government funds the Drug User Liberation Front, which buys and tests illegal drugs for its members to prove a regulated supply can prevent deaths and overdoses. The party says the BC Centre on Substance Use is funding it, but Dolph and others say BC United has it wrong.
All funds that we use to buy currently illicit narcotics.
Hey, dumb fuck. I gotta tell you this. You made our neighborhood so shitty, we all qualify for Canadian eugenic programming. That's called euthanization. Good job. Now even your druggies qualify for euthanization. Who do you really work for? Because you sure in the hell set up the druggies and everybody that lives in our shit show. Everybody.
Come from crowdsourced funding.
Dolph has been buying and testing illicit drugs from the dark web for over a year and giving them to 52 members as part of a study. Its early findings suggest that members have reduced drug use, overdose risk, buying from the black market, and no deaths.
Our program, which sells tested, regulated narcotics, is one.
I'd be more impressed if your creepy self got people off hard drugs. And if your creepy self and people like you, poverty drug pushers, didn't do such a bad job that we all qualify for euthanization downtown east side, and the illegal shit has already started. People have been euthanized illegal. That's really bad because of idiots like you.
Is one of the few successful responses to drug toxicity deaths in our community. Public funding from Vancouver Coastal Health is used.
A dumb fuck? How about say hard drugs kills? Where's a warning downtown east side Vancouver? Why are children dying now? Because you guys failed. And not only did you fail, you made us all qualify for euthanization. There isn't a day I don't know that people are being euthanized in my neighborhood, and I qualify for it.
Used on the development, implementation, and delivery of drug checking services, training and overdose prevention, recognition and response, and harm reduction supplies and equipment.
Vancouver Coastal Health gave $200,000 to Dolph last year, and in a statement says funding we provide to partners for overdose prevention does not go through the
Drug dealers. Drug dealers with no warnings that these hard drugs kill. Incredible. But there's warnings for cigarettes. Oh, and you can't buy cigarettes if you're a kid, but you can get your drug supply from the school. Your little drug equipment that you need to smoke your drugs.
The BCCSU.
It doesn't matter to me whether or not the public funds were actually converted to crypto to be used for the purchase of drugs or not. The bottom line is that this government is providing support, financial support, that comes from the public purse to support an organization that has bought drugs from the dark web.
Vancouver's downtown east side, where Dolph operates, has a toxic drug death rate significantly higher than the rest of the province, according to BC Centre for Disease Control data.
The position of BC United is anti-scientific. It is not backed by evidence. And currently we're in a public health crisis where what we should be listening to is scientific evidence and not demagoguery.
Scientific evidence is called statistics, and you guys have failed everybody. You have failed, and not only have you failed, you've gotten everybody in our neighborhood put on the euthanization list. When is it going to be mandatory instead of your choice?
In Vancouver, Kier Junos, City News.
And in a statement to City News, the Minister of Mental Health and Addictions, Jennifer White
is another diabolical evil.
Says in part, the contract between VCH and Dolph is explicitly for drug checking, overdose prevention training, and harm reduction services. These are critical services to keep people safe and keep people alive. It's extremely disappointing that a partner organization has engaged in illegal activities. I have directed Vancouver Coastal Health to review the funding relationship with this organization.
Okay, so that person doesn't even know that we all qualify for euthanization.